Welcome, Dr. Chethana, to National Dynamic Medical Student Summit 2021.
Thank you, Dr. Sajjan.
Thank you, ma'am. So what we will be looking into is we would like to know the career pathways in as a community medicine specialist, and you have gone a long way after your MBBS to reach the current position, whatever you are. So we would like
Yeah.
to know the insight from the success which you have attained, and what the pathways you have taken, the challenges, and we'd like to get an insight into your life as a community medicine specialist, right?
Okay.
Right, ma'am. So with that, let me move on with our first, interesting question. Why did you choose this specialty?
Well, community medicine may not be the first choice for all of them. So it
Hmm.
wasn't really for me in the beginning. Though
Hmm.
few of my friends did mention that I could be a community medicine specialist when I was in third year, like phase three.
Hmm.
So, but still, yes, my favorite was ophthalmology.
Hmm.
My favorite was ophthalmology. But then later on, as I came into internship, what I saw is there was a lot of uh, interest in field visits and all. So I thought community medicine could be one of the perspectives. And later on, I took it up as a postgraduate. So as you know, community medicine is otherwise called as preventive and social medicine. So there is a lot of scope in preventive activities, is what I feel, and that's what interested me. And we can get to know many people and talk to them. Interaction is there, and that kind of fascinates you.
Great. So you were saying that community medicine was not your no first choice, but you had the core interest even in the third year of MBBS, and going
Yeah.
ahead, the interactions and the community interaction at large, I think pulled you towards this particular specialty.
Sure. Yes.
Great, wonderful. Yeah. So now being for very long in this particular specialty, what do you think the positive or the pros about the specialty itself?
Well, I would say for a person who has a passion for doing some social activities and having a clinical touch into him, and also who is interested in teaching skills and teaching students, and who is interested in communication, for such people, this is definitely the best choice. As in, these are the advantages of being in this. Like I told
Mhm.
you that I was interested in ophthal, but when I took community medicine, I went through this is what fascinated me about. So these are the advantages you have, and it does give me a lot of family time. Like usually
Mhm.
we get, if you're a clinician, you become so busy in life, and I mean your practice, and you go to the clinics, and you're there stuck there for like long hours in the evening, so you miss that family time with the children. So that's something which is very positive about this, which I could relate to. And suppose you're interested in traveling and getting into all these interesting jobs of surveillances and things. Research is something, again, very very important aspect, which is dealt with the community medicine. So if people who are interested in research and academic activities of that kind can be definitely taking in this branch. So that's the advantages of these branch.
Got that. Thank you, ma'am. So basically, one of the key area which you touched is you get a lot of family time. I think that's one of
Yeah.
the areas which most of would be looking into. And of course,
Yeah.
communication, travel, a lot of interaction with the people in the community is one of the positive directions through which you can look into this career. And we
Yes.
have gone through the positive things.
Yeah.
Is there any downfall or the cons regarding this particular career choice?
It depends. Like community medicine has got a big arena. Like you
Mm-hmm.
can join in different areas. So each area has advantages and disadvantages. Like for example, like in quote, say medical college. If you join a medical college as a teaching profession, you want to go into academics and teaching. So there's at some point of time there's a stagnation. Like you don't move ahead of that. So what next is a question which you always have in mind. So there is a
Mm-hmm.
stagnation, and that falls into your routine. So there's nothing something new. You may stop at that. So that could be a disadvantage, I feel. And if you are into an NGO or into surveillance work or something like that, probably some people may not like travel. So that could be a disadvantage again if you want to like stick to a place. So it depends on places, but as such the branch, I feel personally that there aren't any disadvantages as my point of view goes.
Got you. So you get a lot of time for yourself, for your family,
Yes.
and so being the core interest of communication and the satisfaction of
Yeah.
giving back to the students also
Yes.
is an area where
Yes.
you see more of the positive things.
Exactly. So,
Got
you have interaction with students, you have interaction with families, you're serving, you're a clinician, not exactly a pre-para stuff, I believe. It's like
it.
you have
Mm-hmm.
a, you have
Clinical
a,
touch.
propensity towards clinical aspects as well in this subject. So that kind of fascinates me.
Yeah. I got that. So we looked into the pros and the cons and all those things. And in a
Yes.
complete holistic purpose, what type of for whom this career choice would be ideal? Um,
Uh, Career choice, I would say, preferably lady doctors, those who have finished MBBS, ladies who want to settle in a place and who want to, but they do want to have a clinical touch just like me. I'm interested in
mhm,
clinical medicine, of course. So
mhm,
that kind of, so you are into clinics, you are doing some, what you have read as an MBBS student, and uh, you're practicing it as well.
mhm.
And you are having a good quality time. So that way, this definitely is a choice. I should say that girls should take up community medicine because in the long run, of course, family is something which is behind us. So we have to take care of that. When there are two working doctors, like, both husband and wife, so somebody has to be behind. So that definitely you will get, I would recommend. And the second thing is, see, though we are having all these things, there is a particular hours in the day which we can work for the academics, for research. So research oriented people who are interested in doing a lot of research and who want to like specialize in that, who is interested in epidemiology and searching for answers for new questions. So such people, research oriented people, definitely I would recommend that community medicine is, of course, they can do it in other specialties, but they will be masters in research methodology, and they can actually guide many people, and they can do take up researches in multicentric studies and such things like that can be done with this. And of course, who are interested in teaching, who are interested in communication, and who want to have the clinical touch retained. So such people can opt community medicine. They should not get
Got that.
dejected. They should not get dejected that they did not get a clinical branch. Community
Uh-huh.
medicine is, though we put it under pre-para, but it is still having a clinical touch. If you're interested, you can still practice clinical medicine with community medicine with preventive tag on you.
Mhm. Great. So that sounds wonderful, and the lot of areas which you touched, uh, from family, academic to research, no, a lot of specializations which you can look into in this particular area, and also clinical
Yes.
practice
Yeah.
is a clinical touch which you look into.
True.
So great. So now looking forward, if all these areas are available and interest, is there a scope for super specialization? What are the super specialization a student could choose after MD computer
MD community medicine per se does not have any particular super specialties, but you
science?
have diploma degrees which are available in different other branches. Like we can touch upon different other arenas also. Like you can have a diploma in hospital administration, you can have diplomas in MCH care, nutrition, and preventive oncology, preventive cardiology. So, or hospital administration, yeah, that I already mentioned. So epidemiology again. So there are all these diplomas are available. Like we have a particular couple of institutions which are well known, like Public Health Foundation of India, which gives such courses. So you can do add-on courses, but there is no particular super specialty per se in the
Hmm.
branch. Like for example, I can give you ophthalmology. If you can specialize in a fellowship can be done in retina or something like that, lens or something like that. But whereas, or you have a DM in after doing medicine in a particular nephro, cardio. So such thing is not there in community medicine, but you can choose any sub branch. Like it is open. Like I said, I was interested in ophthalmology, so I can think about preventive ophthalmology, what I can learn and what I can do, and what I can serve the community with that. So I'm interested in oncology also. So I have been associated with the Indian Cancer Society. So I do practice certain preventive oncology, though I don't have a degree with it. So you can choose your subspecialties and work on that and research on that and improve yourself. So there is no super specialty per se, though.
Yeah. So I think the very key area which you touched on is, of course, there is no specific super specialization as per other degrees what we have. But whichever the core area of interest you are, either administration or clinical or research, you can take that topic, and of course, a lot of national international organization providing those options to
Yeah.
get this particular degree. Got it. One. Right. So with that, getting in space, so the next would be, what are the career opportunities, like, job opportunities, the growth opportunities in India for post MD community medicine?
Yeah, most of the time, community medicine specialists do look into jobs at medical colleges, because I said teaching is one of the prominent areas which we touch upon as community medicine specialists. So, of course, medical college is one of the options. But let me tell you that a couple of cities where there aren't many medical colleges. I'm lucky. I'm in a city where there are like 5 medical colleges. So we have a chance to flourish, and there's no stagnation. What I feel, you can move on from one to another. But yeah, so medical college is one of the things, but uh, there may be, you may have to be very competent to get through, also get in there with the current number of experts coming out. So
Hmm.
other than that, we have of course NGOs, because they need a lot of administrative support as well as clinical support. And our clinicians are too busy in either their clinics or they are stuck in some other thing. So community medicine is something which we can serve the society through the NGO. We can be administrators, and in the NGO, like helping the functioning of the NGO. And also, you can serve as a clinician in that place. Like, so that is, NGOs are one of the broad areas. Many of my friends have been working in NGOs, and so that is one of the options. Then we do hear about public health cadre. Like, all states do not have that. Only Tamil Nadu has, and Kerala is also proposing to have it. It would be good if it is there, because the administrative areas, if you are an administrator, you would like to be a leader of a team and you would like to take them along. And you would like to, because you have a clinical touch, you can see all this. So healthcare, public health cadre, something called as public health cadre is framed. So in that, you will be the at the highest post of in the individual institute where you are. Okay, so that is one of the options that we have, and that's a government placement. But we have to compete with MPH candidates in this.
Hmm.
So Master of Public Health, they are the pure administrators. They are not clinicians like us. So after MBBS, you have a chance to go to MPH, and then you can become these two. So we have to compete with them in that place. The another thing is with regard to the international organizations. You can join in international organizations like WHO or a UNICEF. So all the immunization and maternal health related things are being dealt by UNICEF. So you get postings and in monitoring or in supportive programs in the UNICEF. You will be you can get through. Okay, as in it comes as a call for, and then you can apply and you can get it, and they renew your contract and you are there for a longer time, and then you can get further higher in that. So, WHOs, basically we have the surveillance officers who are there. Like right now the COVID pandemic is going on, and you've seen that a lot of places where a lot of initiatives have to be taken. So similarly, when we polio and so such diseases, when we have something called as surveillance officers, who are the monitoring bodies, who authorities who take up a larger area, like few districts are given under them, and they are monitoring the activities going on in the prevention and control of these diseases. So surveillance officer is another option which you can opt for. So these are the few of those I have touched upon. And like I said, if you're interested and if you are focusing on a particular, like say preventive oncology or preventive cardiology, so you can practice that as well. And definitely you don't have to think that, okay, I have finished MD community medicine, why should I join a CHC or a PHC as a medical officer or something. That is also an option, because you have seen the community closely. So I think you can give your best. There are very good examples of people who have joined as medical officers in community health centers, and also as PHC doctors, primary healthcare doctors, and they're doing very well. And apart from all this, if you're having a good clinical touch, you can open your own clinic as well. Nobody to stop you.
Got it. So there is a wide variety areas through which you can uh, be placed in an Indian scenario, right? So
Yeah.
being an academician, it could be a clinician, could be an administrator, could be working
One
in an
more thing
NGO.
is you
Yeah,
can be an sorry to interrupt.
yeah.
There is a epidemiologist is another important post that is there in the district, as well as in certain uh, renowned institutions. Epidemiologist, that is also one of the important aspects. If you're good in your research skills and you're interested in research and you have done a lot of funded researches, you have your good CV, you can get through in all these institutions as well.
Great. So that opens up a lot of opportunities. I see for the undergraduates who are looking for the MD community medicine in
Yeah,
India, right? So
yeah.
great. So could you just mention some opportunities which is also available in abroad, which you just touched upon, but if there is some more insight into
Yeah, community medicine per se is not a well-recognized degree in abroad,
that? Hmm.
to be frank. Okay, because I have also tried my opportunities abroad, but when it comes to community medicine, we don't have that. They are more looking for administrators in terms of MPH degree. So
Hmm.
MPH holders are having more weightage as compared to community medicine, because if you want to practice outside in community medicine, either you have to join a medical college, that's the only option you have, or you have to be a really good where the WHO or UNICEF takes you as an international ambassador outside the country where you are going to work, because outside working in another country with for their brand is something totally different, so you have to be really that good. Or another option is uh, uh, you can work as a general practitioner. Of course,
Hmm.
if it's for the pay that you're looking for, it's definitely far better than what you get in India, even for a general practitioner outside. So these are the options for community medicine specialists. So I think we have to get back to general practice there more so, as because I said MPH is a parallel thing which we have to, which is much recognized rather than community medicine.
Got that. So, and when you already brought up regarding the earning potential,
Yeah.
so I think our students would be much would like to know in India and also in abroad. You mentioned in different variety of job opportunities. Could you just give
Yes.
an insight on what were the actual numbers where we were looking into in this area?
Yeah, I can quote a range, as in depends on which institution you are, which state you are. All these things matters, because
Hmm.
we have certain mid the countries. I'm sorry, the states in the northern areas paying you lesser as compared to the southern states. So some of them migrate out here for their things. So it all depends, but generally, if you're in a medical college setup, you would get anywhere from 50K to 1.5 lakhs. So
Hmm.
that could be the range for the if you're you stick to a medical college. Now, suppose you want to get out of your comfort zone and you want to look at other chances, like you want to join an NGO or be a surveillance officer, or you want to work for UNICEF and you want to show bright there. So then your income could be anywhere from 1.5 to 2.5 lakhs. And
Hmm.
suppose you're trying abroad, like I said, uh, it would be either a medical college, or you would be working as a general practitioner. So there the packages start off from 2.5 on. So,
Hmm.
but again, I said it's a general practitioner's this thing, so it will be anywhere from 2 lakhs plus. And if you have gone as an international if you're working under WHO and UNICEF outside the country, of course the package will be equally much higher. So it all depends on what you would like to choose and where you want to be.
Got it. So, however, you gave us some idea on the numbers. So I think that would make some benchmarks for choosing, taking some decisions there. But from apart from all these things, what I think everyone should look into is what is the work-life balance when you're coming to what's the priorities of your life, where would you like to spend more time? So when it comes to
Yes.
community medicine, what do you think the work-life balance and how can you manage
That is something which is the most positive aspect about this subject. So you get a lot of you can have a very good work life balance, or rather you can balance it well. Okay. So I don't see that like, yes, sometimes some aspects, of course, you may have a misbalance, but then always it stabilizes back faster.
that?
So if you want to you have your objectives clear, and you focus on your work in the working time, then rest of the time is yours.
Wow, that's a wonderful insight. Going ahead with the same specialty, uh, going down next 5 years or 10 years,
Yeah.
what how do you see the future of community medicine as a specialty, the popularity and the importance in the community?
Yes. I can quote the example of few of the diseases that we have seen lately, like Nipah and COVID and all these emerging diseases which are coming. With that, prevention and even the chronic diseases like diabetes, hypertension. So any disease you take, we have a role to play. So it's not a subject which is going to die off in a few years. Prevention is always going to be the emphasis in the future, and
Hmm.
now and before. So, of course, this subject is going to have a lot of importance in the coming years. So I see a bright future. But yes, there may be at some point there may be saturation, but always there is an opportunity for saturation sets in all branches and various subjects as well. So there could be that, but still I see a bright future because prevention is better than cure, we always say. So prevention focus is not going to die off any day. So that's where I see community medicine as.
Right. Great. So you mentioned that the COVID and all the emerging diseases. So the post-COVID era would be very challenging, and with the
Yeah.
awareness is what we have in the community right now, I think the community medicine would be one of the leading areas.
Yes.
The entire public would be looking forward to.
Yeah.
Great.
Yeah.
So now moving ahead, now could you share some experiences in general in the specialty so that we get an insight of what happens there?
um, uh, the experience has been wonderful for me, at least,
Hmm.
because I I have evolved as a teacher since my younger days. We have some dreams with us. So my first dream was to be a dancer, and then
Hmm.
next thing was to be a teacher. And every child, I believe, thinks to be a teacher some or the other, through the age process as they grow, because
Yeah.
they see the teacher, so they want to be a teacher. So that's where the passion for teaching began, in fact. And once I enrolled myself into MBBS, I used to teach my co friends and try to impart whatever knowledge I had. So since then, my friends would always say that you are good in communication, good in teaching, so you should opt community medicine. But my passion, I said, was ophthalmology. So, but when I took community medicine, I really went to the field. I saw the work of all these ASHA workers and A&M, worked closely to them. Believe me, it was a wonderful feeling. I didn't even look back after that. So I took up community medicine. I practiced as much as I could regarding, it's being health education, giving. At the end of the session, all the people will give you that smile, the smile of satisfaction, the smile of understanding, a smile that tells me, okay, they will at least take 1% of what I have told and will change their behavior. So that is what satisfaction I get at the end of the most of the sessions that I take. So I'm more interested in health education, basically. So I have given a lot of programs in and around my place of residence and my workplace. So that gives you a lot of satisfaction as you're practicing it. We do say, and even for example, a patient comes to you, what happens usually in a clinician's busy setup is you have 20 patients lined out there, and that one person comes, he wants to talk to you, but the clinician just examines him, tells him, gives him medicines, you tell, and then he asks, 20 more questions to ask him, but there is no time. He will should be shunned off. But here we are giving all the people who come to us in our health centers, especially. So we give them the time. They talk to us. They sit to us. Okay, there's a next patient. Okay, we'll come back to you in some time. We call the next patient. We go back to the same patient back, or they keep coming back to us because we have something called as a family folder system. So they come back to our centers. So when they come, they talk to you. Then they will like last, even though we are so younger, even now, like, it's a fast moving era where people are like, doctors are everywhere, but still the couple of them who really, they are really happy to talk to you because there is somebody to talk, especially the geriatric population. They tell you one namaste and go, and then they're like, thank you, doctor A. They'll tell you in their local language usually, and they go with that smile. They say that they're happy to talk, there's somebody to talk, they have explained all these things. So that's what we are doing. Actually, we are trying to explain to them. So at the end of this, the satisfaction is mine, as in I have done something good to them, they have understood it. So that's where, and research, of course, I have been interested in research since the postgraduate days. So whenever I set everything right and I work on it, it really gives me a great feeling.
Wonderful, wonderful. That's a wonderful journey, and no, thank you so much for sharing that experience with us.
Thank
Really
you.
inspires us. Right. Ma'am, so being in this field with a lot of experience, and there would be some challenges which you have to face. Could you just say what challenges have you come across in this career?
Challenges in the sense, um, to be frankly, for students, I would say, when it is community medicine, the first thing they think is about writing exam, by hearting those stuff and all those things. So exam giving is definitely a challenge to get into it and pass and clear off. But subsequently after that, you have to practice what you have learned. That's
Mhm.
itself a challenge. Everybody may not get the opportunity to do that. So especially preventive medicine is not which you sit in the room and you can preach people. Like, of course, now online sessions are available, but still I'm saying it's not something which you can sit in a room and you can preach. So going out of your usual boundaries and doing what you want to do actually is a challenge in itself.
Correct. That sounds interesting. Right. Could you just tell us one best thing about the specialty which you feel about this? I know you mentioned many, but what was the best thing or the best part of taking this specialty for you?
Best part is um, I get to interact with a lot of people. That's what's the best part.
Got it. And
And I
I
can
got
I can get into the depth of them. So that's the best part.
wonderful, wonderful. Right. You get to touch at once many lives through health educations, maybe
Yes,
10,
yes,
20, 100, 200 at once.
yes.
So that's, I get that. So wonderful, ma'am. Now coming to the final part, what would be your guidance for the young upcoming MBBS graduates regarding the
Yeah.
specialty, and what do you guide them forward to?
I would say don't get dejected if you don't get a clinical subject. You are looking at ophthalmology, OBG, or radiology, or medicine. Don't get dejected. If you are getting community medicine, say for example, after NEET, go ahead, take it. And then whichever subject you had passion for, you try to bring it into your subject and you try to be. Now, community medicine is something which has got like, the options are open for you. So there is no particular thing, there's no restriction that, okay, if you become an obstetrician, you can do only certain limitations. If you are a pediatrician, you can do only certain limitations. If you are a ENT specialist, you have your boundaries, but community medicine, we don't have boundaries. We can actually practice. If you're interested, you can practice anything from this. You can do anything. You can go take it to the next level if you want. So don't get dejected if you don't get a clinical subject. If you're getting community medicine, you take it and you bring in the clinical stuff in this as well. So community medicine is not restricted to, I said, like, it's not in a room, it's not fixed there. So you have opportunity to meet people, to serve the society, to definitely earning your living is not at all a problem. And if you want to do something better than that, you also have options. So I'm satisfied as a community medicine specialist. And of course, the friends whom I've interacted to, many of them who are interested in communication, teaching, and in clinicals have found satisfaction in this subject. So definitely, if you're having an option of community medicine, I would recommend you could take it. And you can specialize, or you can not specialize exactly. You can bring in the specialty which was in your mind in this subject as well.
Great. Thank you so much, ma'am. That was a wonderful insight. And I think the entire you sharing the experience of you being in the specialty and the entire experience of the field activities, all those things, I think it would surely inspire the students in looking into what they would like from. And I think there's a lot of takeaway messages from the insights which you're given for the relevance for that particular student's life. I think they could make a particular informed decision on if there is a choice of taking a computer medicine as a specialty. Thank you so much for the contribution, and I think we look forward if the students could get benefited out of the sharing you have done from your life. Thank you so much, ma'am.
Thank you, Dr. Sajjan, for having me here. And it's really nice to interact with you, and hope students get benefit from what they have, and so that they can make a wise decision and be satisfied with the decision what they finally make.
Yes, thank you, Dr. Chethana. Thank you so much.
Isn't this valuable to know the career pathway of a specialist? Hear from experiences of 50 plus consultant doctors from across India. Get an insight into 22 plus medical specialties and make an informed career decision which will shape your future. Join India's first of a kind online medical specialty summit exclusively designed